to Bliss. Today we have a very special guest, Dr. Beth Lancaster. She is a chiropractor and she specializes in pregnancies and pediatric care. Now, Beth is very special to me because she actually was at my birth and Maya here was stuck in my pelvis. Her little cheekbone right here was stuck on my back coccyx bone on my tailbone, so she wasn't able to come down through my birth canal. Now, before Beth came to help out, we tried everything. My midwives had me in different positions to try to rotate Maya down, but nothing was working. In hours into labor, Beth showed up. Now, she just did a couple of adjustments and got Maya unstuck, and it turned out that my tailbone was injured in my previous sports, so there's no way of knowing that unless Beth was there. And if Beth didn't show up, we would have gone straight to a C-section because there's no way for them to know why she was not descending the way she was supposed to. Therefore, she would have been emergency C-section. So luckily, I got the birth I wanted, all natural without any interventions. So I'm very thankful for Beth, and I am so excited to share her information with you guys.
Good job. I think people don't realize that chiropractic can help with pregnancy and that it's completely safe. And that you have to realize that in your pelvis, your uterus is suspended by ligaments from your sacrum, your pubic bone, and your coccyx. So if you have torsion in your pelvis, you're going to have torsion in your uterus. So if you have torsion in your uterus, the baby can't be in the best possible position. So with chiropractic, we keep the pelvis in the best possible position, so all the ligaments suspend the uterus exactly where it should be, keep the pelvic floor balanced so we don't have torsion in the cervix, so that when it does come to have time for labor, the cervix can open properly, the baby can descend properly, there can be proper pressure on the cervix, the baby's occiput's putting pressure on the cervix, so it's the best possible birth. And like in your case, your sacrum was buckled so that the baby was into the sacrum so it couldn't descend, come under the pubic bone, and actually start putting pressure on the cervix. So we were able to get the sacrum where it needed to be so the baby could descend properly. Also, you've got nerve bundles there, so we want to keep the pressure off the nerve, but also keep proper sorry, I'm totally distracted by mine now.
I know, it's hard, huh?
Keep proper nerve function to the baby so that your nervous system is communicating with the baby, communicating with your uterus, and communicating with the placenta, and making sure everything's exactly how it should be. We can get rid of almost any pregnancy pain. We can do different types of releases to get the baby where it needs to be. If for some reason, you know, the baby's breech or baby's transverse, we can use gravity to get the baby to turn as long as we get the mom's pelvis aligned where it needs to be. So as long as we get, and this is done without ever even touching the baby. So we just adjust the sacrum, adjust the pelvis, you know, do some inversions, do some different techniques that releases the torsion in the mom's pelvis, the baby can move. So if there's not something blocking the baby like a fibroid or a bicoordinate uterus, if the umbilical cord is long enough, the baby will turn. So as long as there's not something going on, the baby will turn.
Yeah, and that's huge because if you were to go to the hospital and the baby was breech, it would be automatic C-section.
Automatic C-section.
So this would definitely be very beneficial to go in. You know, it's cheaper to go to get the baby switched and what's the word I'm looking for?
Get the baby, well, just in the best possible position for birth.
Right.
And even just posterior babies. You know, posterior babies just needs a slight turn, and usually that's some sort of in utero restriction. A lot of times that just takes a little side compression so that it releases the torsion in the pelvic diaphragm and allows the baby just to turn. So it's a lot of really simple things that we do for the mom that allows the baby to move. And doctors don't know about this. They're taught that chiropractic's bad, so they don't even think about it. And a lot of we can even do, if we were allowed to, at the hospital, you know, while the mom's in labor. And it's very much similar to you. As long as the baby's not descended and engaged, and as long as the water hasn't broke, we can do so much.
Right, to help prevent from unnecessary...
Prevent C-section.
Awesome. So I know in our case, she was having problems breastfeeding on my left side, and then when I came to you, it 100% fixed it. She was latching better, she was eating better, and she was more happy on my left side. So what are some benefits that you could help with postpartum stuff?
So most La Leche people and most doctors and nurses always look to the mom when the baby's not nursing right and will blame the mom. And usually it's not a problem with the mom. So when the baby is born, the cranial bones have to mold and then come back out. Well, if they don't come out just perfect, there can be torsion in the jaw, which doesn't allow the baby to latch on correctly. So we work with the cranial bones and we get the jaw to realign and the baby can nurse. We can check the hyoid. So there's a lot of little things with the baby, and it's super gentle. That makes a big difference with nursing. And we see that a lot. And we see that a lot with babies that aren't in perfect position for the whole time, because they'll have a hand up pushing on the jaw, they'll have torsion where it shouldn't be, and then there's some cranial distortion, which affects the jaw and the latch. Also, if we have upper cranial distortion, we're going to have problems with the palate and the vomer, so it's going to be too high so the baby can't latch. So we'll go in the mouth, make sure the vomer's good, make sure the palate's good, which is what we did right after she was born. Made sure that she could suck, made sure that the vomer was where it should be, make sure the palate was where it should be. We didn't adjust her jaw, but we made sure that she could suck.
Right, yeah, whatever you did, it just made everything better. Yeah, that's a huge one, because like you said, most women think it's their fault that, you're holding her wrong, or, there's just something, you have a, abnormally big nipple or something that is causing baby to not suck right, but...
Yeah, in the 10 years that we've been working on babies, we've had one instance where it was the mom and not the baby.
Wow,
and we fully worked on the baby, and and it was the mom, and it eventually worked out. But that's a pretty high percentage. It's usually the baby.
That's really good.
It's
Wow.
usually instantly fixable.
Wow, that's good to know. Let me think if I had any other questions or thoughts or comments. Well, you have some great information, and I'm so excited to share what you have taught us, because I know through our experience, because she was stuck in my pelvis, like you were saying, that there was no way my midwives could fix it. We tried everything. We tried different positions. We tried the pool. We tried putting my butt up in the air and to help with that, but nothing was working, and it would have ended up into a C-section. They would have had the tables right there ready for me, and I would have gone straight into a C-section. So I know in this case, it has definitely turned my birth around, and I'm very thankful, and I hope that this information can help other people's births too, because it just made it so much simpler and easier on the baby too. Because
anytime there's a malposition of the baby, you should try chiropractic, because most likely it's going to be a torsion in the mom's diaphragm, the pelvic diaphragm, and torsion in the pelvis, torsion in the uterus. If we can get everything back aligned, the baby can move. The baby wants to be head down. Gravity pulls the baby head down. Gravity pulls the baby in the best possible position. So if we release all restrictions, that's where the baby's going to go. As long as there isn't, like I said, a fibroid, a bicoordinate uterus, or something wrong with the cord. Otherwise, the baby's going to move.
And it's less stressful on the baby too, because I know other interventions can be very stressful on the baby and raise the heart rate of the baby, which is not good.
And I don't know if you remember, but we only touched the baby in order to find where the head was and where the butt was. That's the only time we ever touched the baby.
Right.
Otherwise, everything was done to you, and we never ever manipulated the baby ever.
Exactly, yeah. She's so funny, she's listening.
We love her.
Awesome. Well, thank you so much for your time, and that was super helpful for me, and I hope it helps other women. Awesome. Thank you, Beth. Thanks for your time.
Thank you.